While many look to the imminent distribution of the coronavirus vaccine as a sign of hope, the UN chief warned the social and economic impact of COVID-19 is, quote, enormous and growing. Secretary General Antonio Guterres pointed to rising poverty, famine, and the prospect of, quote, the biggest global recession in 8 decades. He also accused some countries of ignoring the World Health Organization's recommendations at the start of the crisis. Here in the United States, hospitals and healthcare workers are being stretched thin as the daily death toll across the nation climbs. Nearly 2,900 Americans lost their lives to COVID-19 yesterday alone. To put that into perspective, that is almost as many as were lost on September 11th. Adriana Diaz is following the nationwide efforts to fight the surge.
Vlad and Marie, the mayor said yesterday that the advisory remains in place. The risk is just too high here and across the country. Listen to this. Over the last 2 weeks, 34 states broke daily records for coronavirus cases. And that means more patients flooding into hospitals like this one here at Rush University Medical Center, where admissions are up. Many hospitals nationwide say they are being simply stretched too thin.
If we don't act now, our hospital system will be overwhelmed.
California Governor Gavin Newsom announced plans to impose the strictest lockdown orders his state has seen since March, after hospitalizations there jumped nearly 200% in the last month.
We are announcing and introducing a regional stay-at-home order in the state of California, fundamentally predicated on the need to stop gathering with people outside of your household.
The order shutters salons and bars and limits restaurants to takeout and delivery only in regions of the state where ICUs reach 85% capacity. The governor expects most of the state to hit that threshold in the next few days. Help is on the way in the form of new vaccines, one of which was already approved in the UK. On the CBS News podcast, The Takeout, our Major Garrett asked Dr. Anthony Fauci why the UK approved Pfizer's vaccine first.
I love the Brits. They're great. They're good scientists. But they just took the data from the Pfizer company, and instead of scrutinizing it really, really carefully, they said, OK, let's approve it. That's it.
Fauci later apologized, saying he has confidence in the UK's scientists and regulators. But a vaccine can't come soon enough. On Chicago's South Side, the crush of new COVID patients has doctors and nurses at Roseland Community Hospital wondering how long they can hold on.
I'm actually afraid that we're going to get overrun.
Nurses like Alma Abad don't just treat COVID patients, she comforts them. In the ICU, she set up this iPad to connect 85-year-old Florence Bolton to her grandkids.
We love you. We love you.
It's that kind of separation that makes losing a loved one to this virus especially cruel, says Patrick Brent. He lost his 72-year-old mother, Janice Brent, to COVID just 10 days ago.
I couldn't go to Chicago. I couldn't be with her. I couldn't hold her. I couldn't hug her. I couldn't even see her. And the last time I hugged her was, a year ago. And she's gone. She's gone.
And we have some developments on the Pfizer vaccine. According to the Wall Street Journal, the company had to cut its production target for the end of the year in half because of issues with ingredient standards. The company says it made those revisions back in November and that the U.S. is still on track to receive its 20 million dose allotment by the end of the year. Vlad, Anne-Marie.
Okay, Adriana, thank you very much. So we want to dig in deeper to all of this stuff and bring in Dr. Bob Lahita. He is a professor of medicine at the New York Medical College and chairman of medicine at St. Joseph University Hospital. Thank you so much for joining us, Doctor. Always love talking to you. So, in Adriana's piece, we heard on Major Garrett's podcast, The Takeout, Dr. Anthony Fauci appeared to be a little bit critical of, the UK's process to approve the Pfizer coronavirus vaccine. He later kind of clarified his comments, and he said, he wasn't sort of suggesting anything negative, just that the process in the US is much different. Still, the European Union's drug regulators offered some cautious criticism as well when it comes to the process in the UK. Can we just revisit the difference between what happens here in the US, what may happen in the European Union versus what happened in the UK, why they were able to approve this vaccine so further ahead than everyone else?
Right. Thanks, Anne-Marie, for that. The process in the UK is rather simple. they do not go through the very channels that we go through in our FDA, the Drug Administration, the Federal Drug Administration. What we go through before we approve a vaccine or any drug for that matter is we have an oversight committee from the FDA that looks at the data and sets up a meeting of experts. The experts is called the FDA Advisory Committee. This consists of epidemiologists, infectious disease people and all, and they sit in a building such as an airplane hangar, along with company executives and company scientists. And they go through the data slide by slide, meaning that they project the slides on the wall where you see the graphs, you see the side effects, you see the people that fell out, the people that were tested, the age groups, etc. We don't know if the UK does that. They have the National Health Service. And even though I'm a fellow of the Royal College, I do not know what the process is in the UK. I would imagine they have a screening process, but probably not as bureaucratic and as official as we do here in the United States. And so that's the difference. So they were able to get a little bit farther ahead of us, maybe by a week or two, which is inconsequential as far as the vaccine goes. Anne-Marie?
Dr. Bob, can I ask you one of the things Anne-Marie and I were just talking about is the availability of vaccines. And I'm just curious, from your perspective, your hospital, what are you hearing about when you would receive a shipment, a series of vaccines available to your hospital for your patients? How's it going to roll out?
Well, it's going to roll out pretty quickly because we already are providing freezer space for the vaccine, which has to be frozen at about minus 70 degrees. We're getting liquid nitrogen supplies. All of these things are there for this messenger RNA vaccine, which is very, very special. Messenger RNA happens to be quite labile. Having worked with it in my research days, it was very, very fastidious as a molecule. So we want to make sure that that's intact when the patients get it. Now, we as healthcare workers are looking forward to getting our vaccine within the next 2 weeks. This is very, very important to us because everybody is very skittish. People are dressed up in Tyvek suits with masks upon masks and washing hands every 5 minutes. I mean, it is quite an event. It's quite something to see, actually, if you're into healthcare. Fortunately, the public doesn't get to see that unless you're a patient. So we're geared up for this. We're ready to get the vaccines. And then after us are going to be people in nursing homes and the elderly who have comorbidities and those people who are at great risk of dying from this. And of course, Vlad, then there's those people which we simply don't know. They get the virus and they succumb to it very quickly. We really have no biological basis to understand that right now.
The New York Times has this sort of interesting little list of questions to ask you to figure out where you might be in the line to get COVID, and I just quickly did it, and I am, there's 4 people behind me. I'm pretty much at the end of the line, which I suppose is a good thing because I guess it means I'm less susceptible and in a good position to be protected from it and not in as much need. But a new study published in the New England Journal of Medicine suggests that Moderna's coronavirus vaccine could protect people from the illness for at least 3 months. What can you tell us about that research and just how significant are these findings?
These findings are quite significant, actually, Anne-Marie. They looked at people from the ages of 18 to 70 and then maybe even over 70. So they didn't look at little children, but Moderna, their injection is 28 days apart versus the Pfizer injection, which is 21 days apart. And they saw that virus neutralizing antibodies decrease slightly after 3 months, after the booster vaccination. That's 90 days out from the second injection, which is not surprising. But you've got to remember that the immune system is very, very complex, and that neutralizing antibodies are only one aspect of the immune response that we have in our bodies. We have something called T lymphocyte or T cell responses that are quite specific. There are also substances called cytokines, which are messengers between the cells that are boosted up when you get a vaccine, and they talk to each other, these cells. So your cells, believe it or not, are deciding, well, let's foster this immune response. Let's keep it going beyond 3 months, and it may be largely T cells, like within 6 months to a year. And then there's all sorts of other cytokines or chemicals chemicals that are secreted that are not being measured right now. So it's pretty substantive, and the data are really impressive. I have to say that.
All right, Dr. Bob Lahita, as always, my friend, thank you very much. Have a wonderful weekend.
Thank you. Thank you, everybody.